I'm Dr. Angie Stamm.
And I'm Kaela McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Welcome to the Integrative Connections podcast, a wellness podcast for both pets and people. I am Kaela McGuire and
I'm Dr. Angie.
Today we're going to talk about common health challenges in both dogs and cats. And we're going to get the perspective from Dr. Angie, who's been a holistic vet for over 25 years. So we're going to get the integrative perspective on how we can treat and prevent all of these scenarios with our pets.
Awesome.
Thank you for joining us. I'm so excited.
Thanks for having me.
So let's talk about hip dysplasia. I hear about it, but I don't know much about it. So what breeds do you see? And
yeah, a lot of people don't quite understand what that is. They hear about it from a lot of German Shepherds can have it in their genetic lines, but certainly other breeds. A lot of the giant breed dogs can have it more commonly, but it can really be any breed of dog and even cats, but it's less common in cats.
Okay.
And what it means is actually the hip joints malformed, and there's not good communication connection between the femoral head and the acetabular, the ball and socket joint, so it can be misshapen or very lax, and so then you get a lot of early arthritis formation and degradation of the cartilage, can be really painful. And so it's something that, the breeders can sort of try to, good breeders try to wean it out of their lines, but if you're just getting like a rescue dog, you just never know what you're going to get. It's kind of a crapshoot. So, and even with if you're getting an animal from a breeder that's been tested, all their breeding animals for hip dysplasia, you could still get it. So it's something that is still a problem that we see. I think we're getting better at kind of breeding it out in the breeding stock, but it's still around. So
does it come with age, or is it breed specific?
It's something that's congenital. So they're born with it. It's just literally the shape of their hip joint.
Oh, wow. Okay.
Yeah. And so there's two ways to detect it. There's something called the pen hip, and then there's something called the OFA hip. And so the pen hip is kind of an interesting early detection tool that you can do as soon as 16 weeks in puppies, 16 to 24 weeks.
Oh, wow. Good.
So what we do is we put them under sedation and we take x-rays using different traction techniques to measure how much laxity is in the joint. And so that's probably a smart thing to do, even before the spay and neuter age, which is usually a little bit later, like 6 to 18 months is when we start to spay and neuter. So it might be smart for puppy owners to consider pen hip x-rays.
Okay.
Because there are some early interventions that you could do from both a Western and integrative perspective.
Okay.
So from the Western perspective, at least you would know, okay, we're going to exclude this animal from our breeding lines, or we're going to potentially do a surgical intervention.
Okay.
There are some surgical interventions that can be done, especially in the more severe cases. But from my perspective, from the integrative side, if you had an animal that was positive for hip dysplasia at a very young age like that, you would take certain measures to make that less of a problem as they grow.
Okay.
One thing would be keeping the animal super lean. Do not have them be overweight at all. Keep them as lean as you feel comfortable. Keep them on an anti-inflammatory diet. We've talked about that in other episodes. Using glucosamine, either oral or injectable forms early on, can really help keep that cartilage layer thick and healthy. And then from my perspective, intervening with a technique called prolotherapy, which is an injection technique using dextrose, which creates tightening of the ligaments and muscles around the joint to keep some stability there, would be a really smart thing to do, especially if you're not going to go the surgery route. So that's something that's in some regard a little bit preventable or treatable if you catch it early.
Nice.
If you catch it later, then you have less options.
You're looking at surgery.
Surgery, or you can still do all the techniques I described, the prolotherapy, the diet, the supplements, things like that, but it's harder, and then you could go as far as total hip replacement.
Oh, wow.
Some of those really severe dogs, if we don't catch them until they're older and their joints are all the way formed, sometimes the only good option is a hip replacement, which is quite expensive.
Yeah.
But that is something that can be done. There's also a kind of salvage surgery procedure called a femoral head ostectomy, where they can actually cut off the femoral head and you're eliminating then the joint.
Oh,
which
wow.
sounds crazy, but they can do okay. They're not going to be, an agility dog, but they can function because the muscles will actually hold the leg in place. And so that can, at least in the severe cases, eliminate their pain.
The body is so intelligent. That just blows me away.
Yeah, yeah.
And what are the early indicators or signs that you might look for to see if you need those tests for your dog?
Well, in a puppy, 16 to 24-week-old puppy, sometimes you won't have symptoms. Sometimes they don't see symptoms till they're a year and a half, 2 years old.
Oh, gotcha.
Or even later. So it's, but pain, limping, struggling to get up, soreness, especially after exercise,
Okay.
will be your signs.
So signs likened to arthritis.
Correct.
Okay.
Essentially, it does create arthritis, and that's the symptom that you see.
Gotcha.
Yeah. It's just that you're going to get arthritis.
Okay.
So whatever you can do to detect it early and get on top of it early is your best option for managing it.
Okay.
Yeah.
And would you recommend most pet owners just take that preventative measure just for peace of mind?
Yeah.
Or
I mean, in fact, at our clinic, we've got just got one of my doctors and my technician certified in pen hip technique. So it's not something that every veterinarian knows how to do. It takes a little practice.
Okay.
Getting those traction X-rays, correct. But if you can afford to do those early detection X-rays in a young dog, that would be really smart.
Okay.
Yeah.
Yeah. And can it happen in cats or just dogs?
It can, and
Okay.
And we don't have the pen hip technique down for cats yet, but certainly taking screening X-rays in a young animal, especially if they're having any mobility challenges in a young cat, same techniques and supportive strategies would apply. Anti-inflammatory diet, keeping them lean, all those things. And cats can usually handle, the cats and smaller dogs can usually handle and manage their hip dysplasia better than a large breed or giant breed dog, just because there's so much weight, on those bigger animals. So it's more critical in the big dogs.
Yeah. Gotcha. And what about anxiety? I mean, I would imagine just cases like that would cause anxiety in both the pet and the parent, but anxiety shows up, for all different reasons in pets. So what are the most common reasons that you see, or do you even know where it stems from?
Anxiety is definitely a big problem that veterinarians deal with.
I bet.
In both dogs and cats.
And pet parents.
And humans these days. And I think that's a multifactorial rabbit hole that we could go down. But I think that environmental toxins and EMFs certainly can play a role. So that's a challenge. But
how do you treat it?
There's so many ways, and it's really a case-by-case trial and error. But I usually start by looking at the diet, because same thing for humans. If you're on highly processed diet, that's going to create gut inflammation, and then that's going to, via the gut-brain connection, impact brain function, brain inflammation, and that's the foundation. So I always start with looking at the diet, making sure that's as anti-inflammatory as you can do, and work with your holistic veterinarian on how to achieve that.
Or listen to our episode about diet.
Correct. Yeah. Yes. And then from there, because I've had dogs, for example, that are on high carb, corn-based diets, that all we do is switch the diet and their anxiety really reduces.
Interesting. Okay.
So that's number one. It's always the foundation is diet.
Yep.
Then looking at the relationship with the home environment, with the people, and other animals in the household. Sometimes it's really something that the animal's feeding off of the humans and reflecting back their own anxieties.
Yeah.
Or they have different dynamics between the different pets in the household that are creating stress and anxiety. So looking at those two pieces.
Yeah.
And from there, you can look at underlying medical things like thyroid disease can certainly contribute to that. So running a full thyroid panel for both cats and dogs to eliminate thyroid disease is a possibility. That's easy.
Wow.
Easy
I
to
would
treat.
not connect those.
Oh, absolutely.
Okay.
Super common. So especially if you have a dog or cat that started out not anxious, and then as they reach middle age, or even as young, I've seen hypothyroidism in young dogs even. So if they start out kind of not anxious and then they start to have behavioral changes, increasing anxiety, definitely red flag to get a full thyroid panel done, not just a T4 level.
Good to know.
So those are things that are kind of the low-hanging fruit that you can just easily fix. Then you need to start looking at, okay, we've eliminated all those things. Now we have to go into nutritional supplements, herbs, your CBDs, your reishi mushrooms, calming neurotransmitters, L-tryptophan, GABA, those types of things are all super helpful. Magnesium, all easy to do, super safe. You could probably, just play with those on your own to some extent. There's lots of great products out there. One of my favorites that I learned about at the American Holistic Vet Med Conference last year is a product by Real Mushrooms called the Pet Relax Chews.
Oh.
This is a blend of reishi and lion's mane mushroom, calming neurotransmitters, and calming herbs, all in one easy chew. And those can be great.
Okay.
You can then stack those with that CBD or your magnesium or things like that. There's also certainly Western pharmaceuticals that can be stacked on if needed for the really severe cases, fluoxetine, trazodone, Xanax, or alprazolam.
For like thunderstorms or fireworks or moving.
Well, the fluoxetine is going to be your daily anti-anxiety, and it's not sedating. And then you could stack on trazodone or gabapentin or those sorts of things for really, high anxiety type events. And then you could start looking at more of the unseen things like EMFs. Is there a smart meter outside of the room where the animal's sleeping that's contributing to brain inflammation? Is there a router? Is the cat sleeping on the desk by the router?
Yeah.
By the Wi-Fi router?
Yeah.
Are they laying on your computer while you're working? Those sorts of things. All these things we don't see or feel that could certainly be contributing to anxiety. Same thing for us, right?
Right.
Are they getting enough sunlight, natural sunlight? Are they getting clean water? All these things can stack up and really contribute. So it's a tricky thing to peel away the onions and really, the layers of the onion really get down to what's adding to it, what's contributing. But and certainly there can be genetic component. I think that genetic inherited traumas, emotional traumas can be inherited from mother onto the babies, whether it's during the gestational time or even prior. If you had an animal that was abused, that could potentially be passed down to their offspring.
Wow.
So lots of things to unpack there, but those are some ideas that people could start with.
That's great. 2 questions. So you mentioned magnesium. Are there magnesium supplements for pets?
There are not that I'm aware of that are specific, but magnesium.
But it's safe.
Yeah, super safe.
Okay.
Yeah.
And what would the dose be, or do you have to consult a veterinarian first?
I would work with your vet on the different types of magnesium. Okay. Or you could even look at foods that are rich in magnesium.
Okay. Awesome.
Yep.
And second question is, do you see anxiety more in rescue animals?
I would say,
is there a connection there?
In general, yes.
Okay.
And I think that, again, that goes back to trauma, emotional trauma from either this lifetime or inherited, right? Nutritional deficiencies probably can contribute to that too. So I would say in general, that's a yes.
Okay. Because my dog has severe separation anxiety, and he had a pretty rough first year. I rescued him at 11 months, and I know that something happened there that I didn't, experience myself, but it's pretty evident. But I treat it with, on really bad days, I'll give him CBD just to take the edge off, and sometimes even trazodone, like you mentioned, for fireworks and thunderstorms, because he's one of those that cannot handle loud noises. I feel
like trazodone is a fairly safe and inexpensive tool for an as needed use, right?
Yeah.
So,
yeah. And crate training. I know that I'm not alone in the feeling terrible. Like, I feel like I'm invoking anxiety in a dog when I train them in a crate, but I also know that it's really good for them because they're den animals. And, so what do you recommend with someone during crate training when they're sensitive to their pet's anxiety?
I would work with a trainer, but it's a lot like training your child to sleep through the night. Sometimes you have to kind of...
Some tough love there.
Yeah, a little bit of tough love.
Okay.
And it can be harder, certainly in some animals, but it ultimately is a great tool because once they are comfortable in that environment, it really gives them their safe space, and it can help with anxiety both on the owner side and the animal side.
Just maybe the owner should take some CBD too.
Yeah, or trazodone.
Yeah, exactly. Totally. That's awesome. Totally. And what is disc disease?
Intervertebral disc disease, or IVDD, is super common problem that we see in the veterinary space, certainly humans as well. And that is the cushion or the cartilage space in between each vertebrae that can become diseased, hardened, and even herniate and press into the spinal cord and cause pain, numbness, or even progress to full paralysis.
Oh my goodness.
From my perspective, there can be a genetic component. So the breeds that are predisposed are the brachycephalics, your Frenchies, your Bostons. Those are
smushy faces.
Yes. Those guys have a lot of times misshapen or malformed vertebrae. They're born with malformed vertebrae. And so that's going to automatically predispose them to this. I think that almost all Frenchies that I see have some form of IVDD, and it's a matter of how it presents and how severe it presents. So other breeds that are prone are your long back dogs, your Dachshunds, Corgis, those sorts of things. But German Shepherds, pretty much any breed can have it. The symptoms are going to range from just periodic back or neck pain. Those would be the early signs.
Okay.
And then all the way to numbness or dragging of the limbs, and even all the way to full paralysis.
Oh, wow.
So those would be the symptoms. And if it's in the neck, sometimes they'll have an intermittent lameness on one of the front legs. So sometimes the front leg lamenesses are actually coming from a disc or nerve impingement issue in the neck. I see that a lot as well. So
you've mentioned that if they are licking their paws, it's not necessarily allergies. It could be something in the neck. Is that
correct?
Okay.
Yeah, especially if it's only on one side.
Gotcha.
That's a red flag. So I think that ultimately what happens is it starts out with some muscle tension in the area of the spine or neck, and then that compresses the nerve and blood flow to the disc, and then it cycles from there. So really the ultimate prevention from my perspective is anti-inflammatory diet, of course, comes down to that.
Always comes down to that.
Normal weight, right? You can't have them be obese. That's going to create inflammation and more pressure. And if you can get your animal into some level of chiropractic or massage care, just as a preventative strategy, or acupuncture, whatever makes sense to you, that's going to be the number one. That and the diet are going to be the number one preventative factors. We treat a ton of disc disease at my practice, and I would say the vast majority of those animals that have known disc disease do amazing with just routine chiropractic work. It doesn't even need to be that frequent. Even have them come in quarterly, even if they're not having symptoms. The ones that have had known disc flare-ups, even to the point of numbness or paralysis, those guys definitely need to be on some sort of maintenance bodywork regimen.
Okay.
Chiropractic, acupuncture, massage, laser, all of those things work great, because essentially what you're doing, like Western medicine basically treats it with non-steroidal anti-inflammatories, rest, muscle relaxants, and even steroids.
And there are cases for that.
Right, and those work for short term, but those are just shutting down the symptom of inflammation, but they're not restoring the blood flow and the healing of the disc tissue. So you really need, sometimes both.
You're putting a Band-Aid on the issue rather than getting to the root.
Absolutely. So that's going to actually further degenerate the tissue over time.
Oh, wow.
There are lots of great herbal products that we use, particularly in the Chinese herbal side of things, that work well for improving the blood flow to the back and the spine. as well. So there's lots of different strategies. Antioxidants, vitamin C is great. It slows down aging, helps with tissue healing. And so, yeah, those are all that's kind of the short answer for managing those guys, but it's very, very manageable. We have a very high success rate treating those guys with body work.
Is there an age range that you typically diagnose it more commonly than other ages?
I would say we typically don't see it in dogs and cats under 3 or 4 years of age.
Okay.
Unless they're a brachycephalic that has a malformed vertebrae or some congenital, really severe problem. And it's typically something we see in middle-aged to older animals. Cats can have this too, and same treatment same treatment philosophy applies for those guys as well. But it's definitely more common in dogs.
So when you see a pup who's not using its hind legs and it's using like a little wheelchair, this is probably what it's experiencing, or?
That's the most common.
Okay.
They had a really bad disc disease, disc event where it actually caused permanent paralysis to their spinal cord, and they weren't able to regain function. And so they have to, they can go in a wheelchair. There's other causes, of course, for paralysis.
Of course,
tumors, and fibrocartilaginous emboli can happen, which is where a piece of cartilage breaks off and lodges into the spinal cord and causes an infarct or damage to the cord. Those are way less common. And there's also degenerative myelopathy, which is an autoimmune attack against the nerve sheath, so the nerve signal can't get through. And that can look like a disc disease, a disc issue at first, but it progresses much faster and doesn't respond to the chiropractic, acupuncture, laser. Those dogs are much more poor prognosis.
Gotcha.
But that's less common. The disc issues are very common, as they are in people, but very treatable. So just a matter of early detection and finding a holistic practitioner who can do one of these modalities. And those are becoming much more common. So I was at an event with rescue pups, and there was just this little puppy Frenchie who was dragging his back legs and just crawling with his front, and I figured I was like, this is one of the dogs that you're going to see in a little wheelchair. Yeah, so sad.
So he was probably born with it.
Yeah.
Let's talk about allergies. 'Tis the season.
Yeah, we're in spring. Pollen is flowing down on us.
Yeah. So how would you treat an animal who's just extra itchy or just showing symptoms of allergies that they don't typically show year round?
That's it's a big topic, and it's a complicated one.
Yeah.
So I'll give you kind of some short answers.
Okay.
They can be itchy from environmental causes or food causes, or both. So first answer is piecing out those, taking that apart and looking at that. Looking at the proteins and the grains that are being fed, making sure there's not inflammatory products in the foods. Wheat, corn, chicken are the top offenders, but even the grain-free kibbles that are high in lentils and lentils, chickpea based kibbles that are grain-free, those can be high in glyphosate and trigger allergies and leaky gut. So really looking at trying to do as much fresh, lower carb options, less grains, less legumes in the diet would be and less chicken. I have reasons that I believe that chicken is inflammatory, but we see a ton of animals, cats and dogs, that don't do well in chicken or poultry in general. So looking at that's an easy place to start.
Okay.
You can do food elimination trials where you take out what the dogs or cats been eating, and try something brand new or novel protein for 8 weeks. It takes up to 8 weeks to see a difference.
Right.
The Western vets often use hydrolyzed diets where they take whatever protein they're going to use, soy or chicken, and they enzymatically break down that protein so the immune system can't recognize it as a foreign invader, basically. And that's okay to try for a short term, but I don't think those diets are really nutrient dense enough and anti-inflammatory enough for long-term longevity optimization. But I think those are okay if you wanted to try a hydrolyzed diet for a short time just to see if there's a food component, right?
Okay.
And then there's even saliva testing that you can do for food sensitivities. there's
Just
a
take
lot.
the guesswork out.
Yeah, you can do a NutriScan test through HemoPet. That's one of our favorite ones to use. Costs about $300. You can order the test directly from the company, send in saliva, and then you have at least some guidelines to go forward. Just know that food sensitivities the gut is a dynamic environment. So whatever your animal is testing for right now may not be true forever, but maybe something that you want to eliminate for a while. And then you might be able to work it back in slowly.
Okay.
So that's kind of the quick answer for the food piece.
Yeah.
The environmental piece is certainly location dependent. If your animal is seasonally itchy or gets better when you go somewhere else, like here in the Central California Valley, we see a lot of allergies because we have a lot of tree species and the air quality is poor. We have a lot of particulates in the air. A lot of my clients will say, oh my gosh, when I go to the coast, my dog stops itching. So that's a big clue that obviously it's environmental, right?
So just take a vacation, and then you'll know.
Or go to the mountains or go to the ocean, see if they're less itchy. That's a clue. Okay, it's probably environmental. From there, what do? The best way to approach that is a blood test, or you can go to a dermatologist and do intradermal skin testing for environmental allergies. That's the gold standard. It's a little more expensive to do it that way. We can do blood tests in our clinic, and most vets can do blood allergy testing for environmental. And from there, if they're positive, you can look at doing allergy immunotherapy. And that is a Western treatment, but it's a good Western treatment. It's been done for years and years, decades, in dogs or animals and humans and horses and everybody. And what they're doing is they're taking whatever that animal's allergic to, whether it's grasses, trees, pollens, molds, dust mites, or a combination. Usually it's a combination. And they put little bits of all those allergens into a custom serum, vial, and you inject it or give it orally for a period of 6 to 12 months, a minimum. And then over time, the body will become desensitized a little bit or a lot, depending, to those allergens. So that will allow you to use less of your pharmaceutical anti-itch things or topical and whatever else you're doing. So that's kind of the foundation. That works best in younger animals for some reason.
Okay.
And it has a pretty high success rate of working. It's just a matter of how much it's going to help.
Right.
Some animals have to stay on immunotherapy long term, their whole life, but you can reduce the dosing sometimes or the frequency that you're giving it and still have good success. Some animals can be weaned off after a year or 2 or 3 and still have the benefits. Cost is moderate. It's not a cheap therapy, but it's not oppressive. So that's a great sort of non-immune suppressing therapy. It's kind of the same concept as feeding bee pollen, where you're getting all the different pollens and you're ingesting it.
Right.
And by little bits of it, and the body's like, oh, okay, I see this every day. I'm not going to stress out about it.
Yeah.
Right.
I was thinking exposure therapy.
Yeah. Yeah. So that's kind of a big part of how I like to, if owners are willing to do allergy testing and immunotherapy when we know or suspect it's environmental, that's a great modality to use.
Absolutely.
And then we can certainly go into our Western medications, which I try to use as a last effort, but certainly medications like Cytopoint, which is a monoclonal antibody injection that lasts up to a couple months to calm down the itch response. Can become less effective over time, so you want to try to use that as little as you can.
Okay.
But I feel like that's a pretty safe Band-Aid in my experience, even though it is a Western pharmaceutical. And then the other options are Apoquel, cyclosporine or Atopica, and prednisone. And then there's other antihistamine type products. There's some newer ones coming on too. So those are all like kind of my last options, right? Try to use everything else, including supplements, and supplements can range from your fish oils, your omega-3s, your medicinal mushrooms, quercetin, vitamin C, herbals, so many different things, and that's very much a trial and error. I do think that heavy metals can play a role in allergy, so there's hair and mineral analysis that you can do. Fur for people, fur for animals. Yeah. You can take those samples and have them analyzed for heavy metals. Okay. And look at that. Is there a heavy metal toxic burden that you can eliminate and try to reduce immune stimulation from that can play a role.
I mean,
So
just chemtrails, being outside, you're going to get those heavy metals.
all
So
the
that makes
toxins.
sense. Yeah.
And then the glyphosate in the food is
Right.
causing leaky gut and causing more immune stimulation. So starting with the diet, certainly, and sometimes it's just a matter of changing the diet and maybe putting them on some fish oil.
Ideally.
That's like easy. But
Yeah.
then some of these animals have genetic immune problems with their skin barrier, and no matter what you do, they have to be on immunosuppressive drugs. I've had that happen too. So it's a big, tricky topic, and vets have a lot of challenges with it.
I
They
bet.
can also get a lot of secondary bacterial and yeast infections, secondary to the skin being inflamed and itchy. And then you have to address that too, either topically or internally with medications or herbs. And some of these dogs are actually allergic to their own yeast on their skin that's overgrowing.
Oh my goodness.
And that can be tested through the allergy testing blood test, and that could be included in the immunotherapy.
Oh, okay.
So
I really appreciate integrative medicine so much because you will start with the holistic approach. And if it doesn't work, there is a time and a place for Western medicine,
right.
so.
But start with all the easy things.
Yep.
And allergies really have to be a multimodal approach for most
Right.
pets. It's not an easy thing to manage.
Another two-part question. Do you see allergies in certain breeds more than others?
Yes, to some extent we can see more in the purebred dogs. The doodles especially tend to have
Okay.
more allergy issues.
I wonder why.
Goldens, labs. I think there's a strong genetic component to
Got
some
it.
of these guys.
Okay.
Unfortunately, yeah. Frenchies can have it
Yeah.
a lot.
And other than itching and paw licking, are there any other indicators that your pet might be?
Chronic skin infections, ear infections.
Mm.
Some of them will have a more upper respiratory component, like people,
Mm.
sneezing, watery eyes, coughing even.
Mm.
Allergic airway disease is a thing in animals. Asthma, bronchitis, especially in cats, we see that. Asthma can be related to environmental or food allergies in cats.
Okay. A friend of mine just discovered some black mold in her home, and her cat has been like sneezing and having some real significant upper respiratory issues. So do you think that that's directly related?
Oh, absolutely, I'm sure. Yeah.
Wow.
Yeah, it's just
So
another,
they are no
another
exception.
allergen. Yep.
That's right.
Yep.
Yep. And what about heart disease? How often do you see heart disease?
We see it really commonly.
Do you?
There's two types of heart disease that we see in dogs and cats. One's cardiomyopathy, which is a disease of the heart muscle, and the more common form is mitral valve disease, mitral or tricuspid valve disease, where the valve becomes starts to degenerate. It's a thin flap of tissue, and as they age, this is something that's more typically acquired as they get older.
Gotcha.
The valve in the heart starts to leak because it's thinning or degenerating and causes a murmur and a turbulent blood flow, and then that can progress to making the heart have to work harder, and then the heart becomes enlarged, and then that progresses into heart failure, congestive heart failure. So that one, there are breed dispositions to the valve disease. The Cavaliers are the number one breed for valve disease.
Really? Do you know why, or is it just
It's
their
genetic.
genetics? Got it.
Yep, it's genetic. And there's a lot of the smaller toy breeds develop mitral valve disease. Sometimes it doesn't even have to have any symptoms. It often doesn't have symptoms in the early
great.
stages. Sometimes they don't even have a murmur, but usually an early detection of the murmur is how you'd find it.
Okay.
And then to diagnose it, you need an echocardiogram, which is an ultrasound of the heart, usually done by a cardiologist.
Okay.
And then they will stage it and recommend different medications depending on the stage. The dilated cardiomyopathy, DCM, we see that in Dobermans and Great Danes often, and that's a disease of the heart muscle where the heart becomes enlarged. And that one has been linked to taurine deficiency too, so it can be genetic. It can be a nutritional deficiency of taurine. That can be caused by processed diets that are high in legumes. So say a kibble, grain-free kibble as a mono diet that is the anti-nutrients in the legumes or sweet potatoes are blocking the absorption of taurine, which is an essential amino acid that the heart needs to function optimally. So I definitely, there's a whole like grain-free debate, and that's a whole controversial topic, but dogs don't need grains to prevent their heart does not need grains. It's that they need taurine, and which is very readily available in fresh meat, organs, eggs. So as long as they're getting fresh food in the diet, it's probably not going to be an issue. But if you're feeding a grain-free kibble, that could be a taurine deficiency problem down the road.
And how would a pet parent know? Like, you're not going to know if your dog has a heart murmur or an enlarged heart.
Right.
So how would they even know to...
Yeah, like I say, usually the early symptoms, there are no early symptoms.
Right.
So have your veterinarian listen to the heart once a year.
Just like in a checkup.
Yeah.
And that's how you detect it. Okay.
Yes. And there is a blood test called CardioPet BNP, which is a blood test to measure whether the heart muscle is essentially getting stretched out. And that can be something that can be tested in cats and dogs too for early detection.
All right. Gotcha.
And then in breed predisposed animals, doing screening echocardiograms yearly would be ideal if clients are able to do that.
So thinking about like standard flea and tick medication or heartworm medication or any, they have a lot of chemicals in them, right? So would they cause any issues internally, or?
Not that we know of.
Okay.
Heartworm medication, it depends heartworm medication, depending on what it is. If it's an ivermectin-based product, that actually has been shown to have certain health benefits, so I'm not worried about those.
Okay.
I do think that the chemical flea and tick-based medications can cause stress on the nervous system and the liver and the kidneys over time. So I don't know that there's been any studies to show that those are directly linked to heart problems, though.
Okay. All right.
Yeah.
For some reason, not just.
Yeah.
And you already mentioned the different breeds that you see those most commonly with.
Yep.
So if you have Boxer, Great Dane, Cavalier, just keep your eyes open for this issue.
Absolutely.
Right. So the big C, nobody wants to deal with cancer, especially in their pets.
I know. We have so much cancer in people and pets. I think the stats are now up to 1 in 3 animals are getting cancer in their lifetime, maybe even more. So it's super common.
And I imagine environmental factors play a role. Do you see specific breeds that get it more, or different age groups that get it more?
Yeah. I think the top 3 causes are genetics, environmental toxins, diet that links into environmental toxins, and over-vaccination. Those would be the top 3. And those are all somewhat, to some extent you can control the diet, and you can control the over-vaccination issues. You can't control the genetics. So genetics, golden retrievers are overrepresented, German shepherds, Bernese mountain dogs, but really we see cancer in all the breeds, unfortunately.
Yeah. And can you talk about titer testing just to prevent over-vaccination?
Yeah, so as an aside, you can run vaccine titers, which will, for the core vaccines in dogs and cats, to see if they're adequately immunized against those viruses. And if they are, then you can avoid over-vaccination. So it's something that's coming on board as more and more accepted in the veterinary space, especially with the holistic vets. So
because without that awareness, pet parents feel like they're being responsible, and but the more that they learn what the long-term effects could be,
right,
the more they'll probably want to.
Most of the vaccines carry adjuvants, which have a lot of heavy metals and preservatives that can really create chronic inflammation and even autoimmune dysfunction, and then that can lead to a host of other chronic inflammatory conditions, including cancer.
So if your pet has been significantly vaxxed, then you probably should consider a metal detox. Would you agree?
Mm-hmm.
Okay.
Yeah, for sure.
And what would that look like?
You can use humic and fulvic acid, chlorella, zeolites. You can even go as far as doing metal testing through for mineral analysis just to see what you're dealing with.
Gotcha. Okay. It's worth it for sure. And how would you detect cancer?
Well, we don't have really sophisticated cancer detection tools for pets yet. There are, in the next 3 to 5 years, going to be some early detection, like liquid biopsy blood tests that are becoming more sophisticated and more sensitive. So look for that coming soon.
Okay.
In humans, we can go and get a full body MRI now, which is great. That's not quite on board for pets yet, but so really from an imaging standpoint, the best we can do is chest x-rays and abdominal ultrasound will give us the biggest picture, but really you're looking for big tumors at that point. You're not looking for microscopic early things.
Right.
So blood tests, annual blood testing, and if you have a breed that's predisposed or you're particularly worried because of certain symptoms, then ultrasound, chest x-ray would be the best thing that we have right now.
And let's say you get that terrible news, then how would you treat it so that you can have the best, longest life possible from there?
It really depends on the type of cancer, whether there's any other health conditions, but that's also a whole other topic that we could have an hour or two or longer discussion on. But I can kind of tell you my sort of top 5.
Okay.
Which would be starting with an anti-inflammatory low-carb diet. So a ketogenic style diet is, there's some good evidence that starving the body of glucose will help to really slow or prevent the cancer cells from growing.
Okay.
And that's something that's accessible to really anybody.
Yeah.
And so there's, from my perspective, 3 easy ways that you can do that. One would be you could go to a commercially balanced raw diet, meat, bone, organs, vegetables that are balanced, and many of them are pasteurized now. So that makes it really easy. The animal will tolerate that, easy and safe. You can go to a sort of a hybrid home cooked type of diet, which would be, I really like the Dr. Harvey's Paradigm base, which is broccoli, green beans, bone broth, vitamins and minerals. You add your meat and some healthy fats, maybe some MCT, cod liver oil, omega-3 oil, and then you've got a balanced kind of lower carb, fresh diet that's going to be anti-inflammatory. And that's really the foundation. So if you can only do one thing, that's number 1.
Got it.
You can certainly go the Western oncology route too. And if they're candidates for surgery, radiation oncology, chemotherapy, those are certainly things that can be done and that are pretty sophisticated now, but those are usually palliative also.
I had no idea dogs could have chemo.
Oh yeah. Super commonly done.
Wow.
Yep.
Okay.
And they can tolerate it well, but again, it's usually palliative. It's not really curing the cancer, right? So I think the dogs and cats that do the best are the ones that get sort of the integrative approach, where we look at all the options and pick and choose what's going to be make more sense for that case. In addition to the diet, I use a lot of herbal and nutritional supplements to support the immune system. The top ones are medicinal mushrooms, particularly turkey tail, vitamin C, and melatonin is certainly a big one for cancer, high dose melatonin.
And what's high dose? How many milligrams?
So you can go in the human space, they're using some of these functional medicine doctors are using between 100 and 500 milligrams of melatonin a day.
Wow.
Yeah.
Okay. And I know our bodies produce melatonin. If we supplement it too much, our bodies stop producing it. Is that right?
That is, jury's still out on that.
Okay. Gotcha. So why does melatonin help cancer?
I also don't know the answer to that, but I think that it's still being studied.
But that's so interesting that it's even on the table.
And super safe and inexpensive,
Yeah.
right?
Yeah, for sure.
And then we have a lot of other tools such as ozone therapy, intravenous vitamin C therapy. So there's, a lot of different tools, Chinese herbals that can help to slow the cancer cells and support the immune system, colostrum, a host of different things.
What about sauna wave?
Sauna wave is not Sonawave is hyperthermia. It's a machine that veterinarians can use that combines hyperthermia and pulsed electromagnetic fields and also sound frequencies. And basically it heats the tissue to a specific degree, and that can release heat shock protein. And that is a signal for the body to go in and repair that area of the body. So that's a great adjunctive therapy for cancer as well.
Okay. So find a vet that offers that.
Yeah, but cancer is also really tricky thing to treat, and it's so common.
Have you seen it become more common over the most recent years?
Absolutely. Yeah. Yep.
And you think it's just more toxins in our environment that's causing it, probably?
I think so. And genetics.
Okay.
Yep.
Like the overbreeding and...
Yep.
Oh, it's just so heart-wrenching.
So hard. I know.
And what about kidney disease? How would you even know if your pup has kidney disease? Because mine holds its bladder a lot, and this is always on my mind. It's like, oh my gosh, your poor kidneys. I cannot get that guy to pee sometimes.
Totally. So kidney disease is going to be best detected early on through blood work.
Okay.
If they're having clinical symptoms of kidney disease, which would be increased thirst and urination and sometimes drop in appetite, then you're already pretty in the moderate to more advanced stages.
Oh, wow.
So it really speaks to recommending annual blood testing for middle-aged and older pets.
Okay.
And then if you can catch it in the early stages, it's very manageable.
Okay.
We have really great success using anti-inflammatory diets, low phosphorus diets, moderate protein diets, herbals.
Well, that's comforting.
Yeah, absolutely. Herbals, Romania, cordyceps, different Chinese formulas, acupuncture, ozone therapy, fluid therapy.
Wow.
Probiotics.
Okay.
So it can be very manageable if it's, caught in the early stages and you don't have any underlying infections driving it.
Do you see it more often in dogs or cats?
Cats. We see it more in cats.
Okay.
Super common in cats, but certainly dogs can get it too.
Yeah.
And it's a real problem, especially as they get older.
What do you think causes it?
I think aging stress, oxidative stress from diets, probably over vaccination, probably all the flea and tick issues, certainly infections, viruses, a host of other things, right? So there are preventative strategies, and that would stem from starting with high moisture diets, getting lots of fluids in the diet, so not dry kibble, especially important for cats. That's really helpful for the kidneys, and minimizing their vaccination exposure and their chemical exposure, good quality water. That's all going to help.
It's all plays into each other. And feline lower urinary tract disease.
That's also a common kidney related, it's actually disease of the bladder in cats, you see. And that is where the bladder becomes really inflamed, and they can get crystals. They can actually have blockages of their urine outflow, and it's super painful. And in the Western space, it's traditionally treated with prescription diets that are actually more inflammatory. So from my perspective, many of those cats that, especially if you catch them early in the process, you can reverse it just with a biologically appropriate diet. A lot of those cats are on dry food diets, which causes a lot of inflammation and over concentrating of the urine, and then the bladder gets really inflamed. Stress can certainly be a component in that too. So stress management, all the things we talked about in terms of anxiety reduction would be appropriate there. And also glucosamine, oral or injectable glucosamine has an anti-inflammatory effect on the bladder. So that's something to consider for those cats. But so stress and anti-inflammatory diet, there are surgeries that can be done in severe cases to alleviate their symptoms. But I think that inappropriate diets are a big cause for a lot of those.
As adults, we're supposed to get checked up by a doctor once a year. So would you recommend that with your pets? Just get an annual checkup. And what would that even look like? What would it consist of?
So annual exam, checking the heart, taking care of the teeth, any dental, periodontal disease, palpating the joints for arthritis or swellings, checking the back for any pain. And then certainly at a certain age, 4, 5, 6, or 7, starting doing annual blood testing to track the liver, the kidneys, the inflammatory markers, the blood counts, the thyroid, super important as well.
That's what I was looking for. Yeah.
Yep. Those would be your early detection tools.
Do you see that pet parents take that measure as common as you'd like?
I think so. Yeah.
Okay.
For the most part.
Good.
Yeah.
Way to be responsible.
Yeah, that's great.
Well, this has been incredibly informative. I definitely
gave you the crash course.
I definitely need to re-listen to this with a pen and paper. Is there anything that we didn't cover that I didn't ask you? Or?
I think those are the big topics. I mean, arthritis is another big one, but we covered that in a separate episode because that's a lengthy discussion as well, and a super common problem. But I think that kind of covers the big issues that we tend to see and gives people just a general, place to start on addressing those challenges.
So if somebody is just wanting a dog for the first time, what type of breed do you see the least issues with?
Well, I would say, gosh, that's a hard one. Not Frenchies. I can tell you which ones not to get.
Okay, there we go. Yes.
I'd say Doodles and Frenchies are having a lot of health issues right now.
Okay.
Those are any of the brachycephalic breeds. They have disc issues, skin issues, breathing problems, allergy problems are super rampant. So those are challenging. So definitely, if you're going to get one of those breeds, get insurance.
Okay.
I highly recommend pet insurance for anyone, but certainly a breed that is predisposed to these health challenges, absolutely. And I would say the Frenchies and the Doodles are the ones that we're seeing the most health challenges with nowadays.
Do you think it's because they're the most bred?
Well, the Frenchies are have a lot of genetic challenges because of the shape of their bodies, right?
Okay.
But yeah, so it's a breeding problem.
Do you see as many problems with Boston Terriers as Frenchies?
Not as many.
Or pugs?
Not as many, but pugs definitely are high on the IVDD. And allergy issues, but more disc problems, mobility problems with the pugs. But the Frenchies tend to be the worst. And then Bostons can get disc issues too, but they seem to be not as rampant.
They're the best dogs.
Yes. Humble opinion. Bostons are really sweet.
Oh, well, thank you so much for your time. I always appreciate learning from you.
That helps people.
Yeah, absolutely. And if there's any other situations that you see with your pets chronically that you want more information from Dr. Angie, please give us a comment or send us a message and we'll cover it in another episode. Thanks for joining us and we'll see you next time.
Thank you.